am Crystal Robinson. I've been a hygienist, dental hygienist, for about 13 years now, and now I am also a health educator. And I believe that we must treat the whole body in order to stay healthy. Today I'm going to talk to you about eliminating and managing dental diseases in low-income minority communities. The program goal is designed to teach you, the young minorities from low-income communities, of the different dental diseases that exist. This program will also share the treatment and preventative options available to you. It's our goal to break the barrier, to eliminate the myths that are out there about lack of dental care and dental diseases. And it's mandatory that we start with you, the young people, in order to help get these things out of the minds of everyone so we can get treated for dental diseases. The objectives, we will have guest speakers, we'll have handouts, and we'll also have interactive presentations in order to educate you or to teach you on the dental diseases. You'll also be able to use your new knowledge and form groups within this lesson and make presentations on dental diseases. By the end of the lesson, I think most of you will understand how to prevent and manage, future dental diseases. You'll also develop an interest in maintaining good home care to reduce the risk of your dental disease. And finally, we want to use your presentations to not only help you grow as individuals, but to also help your friends and your family so they have a better understanding of dental diseases as well. Oh my gosh, do I have to go to school after school? No, this is a fun interactive session. It will open your minds to the importance of dental diseases. We come to you, so all the sessions will be held here at the Learning is Everything after school program here in Dallas. The session will start February 1st, which is the National Children's Dental Health Month, and it will we will have 1 hour sessions per day for a week. And the adolescents, for days 4 and 5, you'll have 2 hours to be able to finish your projects and your presentations. And all classes will be held in the health room near the gymnasiums, and the presentations will be on display for the entire month of February so that all patrons will be able to observe them. So, I've already introduced the program to the 6 through 11-year-olds. They have a totally different project going on. They're getting their poster boards, their dental magazines, their pictures, and even their groups together for their lesson. So now I'm going to address the adolescents, my 12 to 16-year-olds. I want you to make your presentations grand. I'm going to have you guys to use poster boards and make brochures through Microsoft Word, Microsoft Publisher. You're also going to use the internet for research. There are so many things out there that's going to be able to help you with this presentation. So I want you to be creative, use your technical skills, and also learn a lot about dental diseases through this project. Why did I choose this group? Well, the reason why I chose this group is because so many times the low-income minority population says, well, I don't have any money, so I'm not going to go to the dentist. Well, I think there's a language barrier. So many times we don't think that our local dentist has someone to speak the language that we speak. Also, where do you live? It depends on your upbringing. Sometimes your friends and family, they don't think it's important for you to go to the dentist. Oh, you're not in pain. Why do you need to go? So it's very important. So we want to help get those ideas out of our head and get ourselves to the dentist to prevent versus when something is hurting. Also, a lot of people are afraid to go, and I'm not saying I can't tell you to not be afraid, but there are things, nitrous oxide, some have TVs, you can watch your favorite show while you're getting dental work done. There are many distractions that are available for you. Don't know what the dentist is talking about. He says, I have 5 cavities. What is that? How did I get that? What do we have to do? It costs how much? All these questions pop into our head when we go to the dentist. We don't understand the terminology. That's okay. Here we will be able to give you a little bit of knowledge about what the dentist is talking about. Why do you need those fillings and those crowns? And no dental insurance. A lot of people stay away from the dentist because they do not have insurance. Their jobs don't offer it in low income minority communities. And so we just neglect ourselves and don't get those treatments done. So I will let you know of different programs that are out there, governmental programs, and also other things that could be done to go ahead and get dental treatment. All of these factors play a role in why the number of dental diseases is on the rise in the low-income community, and we need to stop this. Strategy introduction. Let's ask some questions. So, first of all, who knows what this is and what this is, and who has one? Who has a toothbrush at home, and how often do you use it, and do you floss? Is anybody going to answer that question for me today? You don't have to answer it right now. Do you know what dental diseases are? Can you name one? Maybe even two? Also, who has been to the dentist before? What was your experience there? Are you a little bit nervous? Were you okay? Or have you just never been before? It's okay either way. We're going to get you there. And finally, how does your family think? What does your family think about going to the dentist? Do they think it's important to have these visits? You know, yes or no? These are some questions that will help us evaluate if the plan is successful in the end, and also, you know, what you guys think now of dentistry and dental diseases. Let's floss. Let's take a 5-minute break. We'll be right back, and I'll discuss some good old things with you, such as dental diseases. Okay, so we're back. Everybody had a little break. Did everybody floss? Did everybody get some water? Are you guys ready for the dental diseases? Well, first we have what we call tooth decay or cavities. Tooth decay are literally holes in your teeth caused by acid that are produced from plaque, bacteria, and even sugar. So when all these things sit on your teeth, when you don't brush and floss them off, guess what happens? It kind of gradually eat holes. The bacteria in their mind, they're like, oh, she's not going to take us out, let's have a party, you know. So you're going to get holes in your teeth, such as this little kiddo here. And it can be prevented, though. You know, if you brush and floss at home and visit your dentist for your cleanings, you can get fluoride, which is I'll call it a vitamin for your teeth. And you can also get dental sealants, which are preventive coatings for your teeth to help that bacteria not get into those deep grooves. So you can get those things done to help prevent it. So instead of saying, hey mom, my friend has a party this weekend, or reminding your parents of the things that you want and don't need, let's remind them of, hey, I think I have a dental appointment coming up in 6 months, or whatever the case is. So periodontal disease. Periodontal disease is something that you may not think can happen to young people, but it can. You may think of it as, oh, my mom said she had it and her mom had it, I'm going to get it. You know, you don't have to. It's the swelling and the destruction of the gums and all of the supporting tissues around the gums, the bone, and everything. So plaque builds up when you don't brush and don't floss it off. Guess what happens? Turns into calculus, hard like math, and the only way it can be removed is by a professional. And once it gets to the stage from gingivitis, which is just a little bit of inflammation, and it gets to a stage of moderate periodontal disease here, some inflammation and tissue loss and a little bit of bone loss, guess what happens? It can go into a very severe stage of periodontitis. If anybody wants to walk around with loose adult teeth that cannot be replaced, this is your thing here. Get you some severe periodontitis. And gum disease can only be treated again through a deep cleaning, a professional deep cleaning. And also, it can be managed at home. You have to brush. You can't use one of these brushes. You need a good electric plug and oil brush. You have to floss. And you also have to get a prescription mouth rinse that's going to really help your gums reattach and keep stable and keep strong. Because if you can't build a house on quicksand without falling, you can't have teeth in a weak socket, okay? Other diseases that we really don't think about, oral cancer. So, hey, what does that have to do with me? I'm not an old man. I don't use tobacco, nor do I drink. Well, guess what? Every day in the U.S., here, about 12,000 people ages 15 to ages 24 are infected with the human papillomavirus. Okay, so the human papillomavirus, we always thought of being a genital warts, so you know it can't do anything else. It's leading to cervical cancer, but guess what else? It's leading to oral cancer. And the reason why is because so many people are having many sexual partners, and they become in contact with genital HPV, human papillomavirus, through oral sex. So, in order to help prevent those things, you would want to eliminate those things. So be aware that oral cancer is on the rise in the younger population due to the HPV. Then there's also the cleft lip or palate. It occurs more often in minorities such as Asians, Latinos, and even Native American populations. It's a facial malformation. So basically, when the baby's in the womb, the mouth doesn't heal. The mouth doesn't come together properly. So what happens is you're left with a hole in the roof of your mouth and even a slit and a hole in your lip, leading to the nasal, to the nose. So there are no known causes for it. We don't even know how to prevent this, but it's said to be genetic or even environmental, and even something that the mom could have, a drug that the mom could have taken during her pregnancy. So these are just some of the diseases that affect the low income and minority communities. There are so many more out there, you know, that just arise all the time. So much research is actually going on. But in this procedure, in this presentation, what we're going to do is introduce you to the dental diseases program, so you can know a little bit more about it and be able to share with your friends and family. These are about 1 hour sessions, and they're going to be the first session is 30 minutes each, which is what we're doing now. Your guest speakers will come in, a couple friends of mine, the pedodontist and a dental hygienist that I know, to just elaborate a little bit more on these dental diseases such as the tooth decay, the gingivitis and periodontal disease, oral cancer in relation to the human papillomavirus, and even the cleft palate. And then we will also go over brushing, flossing, crowns, x-rays, fillings, what all these things are, and even how your family thinks about going to the dentist. Each group will be designed, their topic will be designed for each group, each age appropriate group. And they're about 1 hour sessions. We're also going to introduce you to the details of the presentation. So like I said before, you adolescents are going to be using all kinds of technology, and you're even going to make a brochure similar to the one I've made for this program, the diseases among low-income minorities. And it's going to have several pages. You can put pictures in here, you can make a back and the front. And it's going to be so you guys, your friends and family can take home and just don't have to say, oh, I walked through, I saw it, and know nothing else about it. And hopefully we can get some, during the presentation session, we can also get some local dentists in to inform the patrons about where they are and what they can do, services they can provide. We're going to start the project. We're going to delegate the work among the groups. And I expect, like I said, for you to do some good research and design some good projects. So by day 5, 4 and 5, you're going to have 2 hours adolescents because, or young people, shall I say, uh, because I expect a little bit more of you. So your presentations are going to be 2 hours, while the younger kids are going to be about an hour each. The displays will be formally presented in the gym here at the center, and they're going to be presented to dental and dental hygiene professionals. So during week 2 of the National Children's Dental Health Month, you are going to be seeing a lot of dental professionals coming in looking at your project. The presentations will be then located in the health room after the professionals see them. And in the health room, they're going to be able to be viewed by your friends and family for the rest of February. So they're going to be up for a while, so make them good and sturdy. And we will have a final evaluation from each student about what they know about dental diseases. So I'm going to come back, put you in this same room, and ask you some of the same questions and some new questions about what you learned. And to determine if the objectives have been met, to see if I've done my job and my friends have done their job, we're going to compare the questions that we asked you before, the questions that I've asked you during this during the strategy introduction, and also during the final evaluation. So I'm going to put all those things together in order for you in order for me to see if you learned what I expected you to learn. And also, we're going to provide a questionnaire or a little form, checklist form, to the guests that come in to view your project, just to see what they learn from it. It's our goal to reach the public, not just you, not just me, but for everyone to know this information, because it's very important. It's something that everybody needs to know. So whatever you learned today, don't withhold it, just go share it, okay? And then there's always going to be a problem, just like anything else, right? So we do anticipate that some people may have a football game to go to or a volleyball game to go to. So we don't think that everybody's going to show each day. That's fine. You know, we do want you to learn, at least be here so you can engage and help your peers, okay? So we would love for you to be here, but guess what? We understand that you have other things to do, but there will be other people here, such as myself, to help you with your presentation. So they will get completed, and so you will still have an understanding of what's going on. And we also anticipate that some of you will want the same topic. Everybody wants cavities, huh? No, we want everybody to kind of know everything. So we're going to do like a random draw. We're going to separate you guys, divide you up, and let you draw by what we have in the hat. And somebody will get cavities, somebody will get gum disease, oral cancer, cleft palate, and even if we come up with more topics, you guys will share those or grab for those too. And then we anticipate that everyone will not be able to afford the supplies. That's okay. The lesson is fully funded by Dallas Parks and Recreation, so just bring your willingness to learn and your creative minds, and that's all you need. We have the chairs, the tables, the pens, the pencils, magazines, poster boards, internet, computer, everything. All the software to make the brochures, so just come with an open mind. And just so you know, it doesn't stop here. I want you to, every time you see health fairs, go to them. I'm sure there's some free dental screenings there. Also, for the low income minority population, just because we don't have dental insurance doesn't mean we can't get dental treatment. So there are programs funded by the government like Medicaid and CHIPS that allow you to either get free or very low cost procedures done. Also, when you're online, you can go to Colgate Kids. They have interactive things there. The American Dental Association has a lot of information on their page about dental disparities.